Great. So it's lovely for me to introduce Dr. Nola Chambers to all of you. Some of you might have met Nola, but many of you might not. She is a speech and language therapist, trained in South Africa, trained at Wits University, if I remember correctly. And then she did her PhD with Dr. Amy Weatherby, who's an American speech and language pathologist, as they're called in America. And Nola spent some time at Florida State University, where I think she's done a lot of her early learning on autism and autism interventions. But Nola has been a member of our team in the Center for Autism Research in Africa now for a number of years. She leads many of the programs and helps organize all sorts of things. And she really is an expert in the current main approach to interventions for autism, which we call Naturalistic Developmental Behavioural Interventions, or NDBIs, that she'll talk about today. So Nola, thank you for giving us time and for having a discussion with the team about a practical approach, I'm sure you will talk about, of NDBIs for children with autism. So with that, I'm going to hand over to you.
Petrus, thank you very much. Yes, so I am going to spend this hour really talking about NDBIs for children with autism. And I have a little overview here. I want to start with a little bit of a historical context of autism interventions to kind of give you the picture of where NDBIs kind of come from. And then we'll talk a little bit about the goals of NDBIs and the state of the current evidence regarding NDBIs. With some recent meta-analyses, and then we'll dive into talking about specific NDBI strategies, and I've got just a couple of video clips to show you there, and then some closing reflections. So that's what I'm planning to talk about this morning. So the interventions for autism, or ASD, autism spectrum disorder, is quite a long and tricky one actually, and that is because interventions have been developed largely related to assumptions about the cause of autism. So right in the very early days, as we know, autism was only really talked about in the literature from the 1940s, mid-1940s. And one of the very early writers, attributed a really psychodynamic theory of autism. He basically blamed the mothers, and he said autism was a reaction to these cold refrigerator mothers, and it was a problem in attachment. And this developed into an intervention called holding therapy, which was designed to kind of re-establish attachment between the child and their caregiver. And then there was, right on the other end of the spectrum, not a psychological theory about autism, but a biological theory about autism, where, maybe it's caused by heavy metals, which led to chelation therapy, or this leaky gut theory, where there's a seepage of poisonous chemicals into the brain, and so that led to lots of diets and supplements. And around about the 50s and the 60s, another very prominent kind of theory in psychology was behaviorism. Okay, and behaviorism is essentially just a set of principles around learning theory. And there were people around who decided, well, we don't really know what the cause of autism is. It could be psychodynamic, could be metabolic or biological, but could we apply a set of learning strategies from behaviorism, behavioral theory, to help children with autism learn? So essentially, this was an atheoretical approach to autism intervention. They didn't have a view on what the cause of autism was. They really just wanted to see if behavioral theory, in terms of the procedures and the operant conditioning and reinforcement, could help children with autism learn. And they did a lot of little studies in the 50s and the 60s and the 70s. And you must remember that this was when autism was only diagnosed when it was classic autism. Okay, so very kind of marked, significant autism, and a lot of people were in institutions. There was very little understanding of how people with autism could learn, and there was very little hope. And so there were these sort of small efforts at applying behavioral theory to teaching people with autism to learn various skills, and they were partly successful. While the intervention was happening, people could learn. But they were sort of in small bursts, and then when the intervention wasn't happening, people regressed. There was no generalization. And so this sort of led to more intensive efforts on the part of behaviorism. And there's a real landmark study that was published in 1987 by Ivar Lovaas, which I'm going to talk to you in about a little bit of detail, because I kind of think it gives us the springboard then to talk about NDBIs. So basically, because all these little studies of behavioral theory were providing some good but very limited results, the goal of this particular study was to maximize the behavioral treatment gains that they had seen in the smaller studies by treating autistic children during most of their waking hours for many years. So basically the premise was, well, if we just do it all the time for many years and for as much time as possible, will the gains be, will they last longer and be more profound? And they used a non-randomized control group. There were 19 children in the intensive treatment group who received more than 40 hours per week of one-to-one intervention in their home and their school and their community, which is a lot. If you think of 40 hours a week, that's your work week. And there were two control groups. One was the minimal control group, who received 10 or less hours per week of one-to-one. Now, if you think of 10 hours per week, that's 5 days a week of 2 hours. That's actually still quite intensive by many standards. And then a second control group who was not associated at all with their study lab. They were in a neighboring lab. And it's important to note that it's non-randomized, okay? So that intensive treatment group would have been a very motivated group. And, we can't, that is a definite limitation of the study design. And here were some of the goals of their intervention. In the first year, they wanted to reduce self-stimulatory and aggressive behaviors. They wanted to build compliance, make children very obedient, teach them to imitate, teach some appropriate toy play, and extend the treatment into the family. In the second year, they focused more on language, expressive and even comprehension of language, interactive play with peers, and functioning within a preschool group. And then in the third year, there was a lot of talk on emotions and pre-academic tasks and observational learning. And they used their typical behavioral conditioning, operant conditioning and reinforcement in a highly structured program, which was entirely adult-led. So there was a very detailed, worked-out curriculum, and it was structured by the adults. And the trials were called discrete trial training. And so every trial had some kind of stimulus that was maybe a question or a command by the adult, a prompt to help the child get to the desired behavior, the target behavior, which was the thing that their goals that they were working towards, and a reinforcement. And the reinforcement was designed to either increase the likelihood of that behavior happening again or to decrease it. And they used lots of positive reinforcement. Often this was verbal, like good looking or good talking. And sometimes this was also tangible. So if you labeled your 3 pictures in a row correctly, you might get a little piece of cookie. Or if you did your 3 correctly, you might get a little star or a piece of a chip or something like that. But they also included some negative reinforcement or punishments. And this included things like a loud no, shouting no, slap on the thigh. The very early studies, not this study, also included some electric shocks, which was obviously, none of those things would be acceptable in interventions today. But what did they find? Well, for the time, it was really quite profound, because nearly half of that group of 19 achieved normal intellectual and educational functioning on standardized tests, and a successful first grade performance in a public school. And if you think about it again, this is at a time when most people with autism were just told to put their child in an institution. So it was powerful results. But another sort of proportion, and I put using inverted commas here because this is not terms that we use today, were mildly impaired and assigned to special classes for language-delayed children, and 2 children were still profoundly impaired and were in special classes. So even that 40 hours a week did not help those particular children. And then they lumped the 2 control groups together. Okay, so remember, this is children still receiving 10 hours a week, and then the others. And one of those children achieved normal educational and intellectual functioning according to their criteria. A similar proportion to the intensive group were mildly impaired and in special classes, but just over half were still severely impaired and in autistic or special classes. So this really was quite profound for the time, and really sort of showed that children with autism can learn. And it spawned a whole body of research based on this work. And you might see it referred to in the literature as ABA, Applied Behavior Analysis. And there are also other names for different offshoots of it called EIBI, which is Early Intensive Behavioral Intervention, Discrete Child Training, or Verbal Behavior. But obviously these gains came at a cost, right? It's extremely labor intensive and cost intensive to have that amount of hours of intervention and a stranger in your home and in your life. Obviously there was inappropriate use of negative reinforcement and punishments, which would never be condoned today. And even so, there was still, you know, even while throwing all of that time and effort at the difficulty, there was still lack of generalization and especially initiation of communication. You know, by having it so adult-led and structured, it didn't give children the opportunity to learn to use their skills in a spontaneous initiating way. Other reports have said that a lot of children who get through ABA have quite low intrinsic motivation because of all of this external and artificial use of reinforcers. And also there's been a high degree of prompt dependence when prompts are not reduced sort of timelessly. And I just want to sort of state out there that when we're thinking about and talking about ABA, that you must be aware also now that many children who've gone through ABA as children and have grown up now into adults and self-advocates have very strong anti-ABA sentiments. In fact, some would even talk about ABA as child abuse, you know, being submitted to all of this kind of this incredible drill-like work for many, many years, hours and years in childhood. Now, at the same sort of time, I would say in the 70s, this was becoming really prevalent. There was a whole move within the psychological literature and in the speech-language pathology field, focusing on social pragmatics. So this is really a focus on, you know, in almost complete opposition to behaviorism, you know, and the structure of language. Why do we use language? What is the reason we communicate with one another? What are the unwritten rules of social interaction that you know we pick up, like how close to stand to a person, or the use of our body language or our facial expression, how long to look at a person before it gets weird? And there was a real explosion in the literature of this kind of work in typical development and then applied to children with disabilities. Carol Prutting is one of the main who spearheaded a lot of this work. And this paper was published in 1998. It's a very handy little paper because it really contrasts the social pragmatic developmental theoretical approach or paradigm to the behavioral paradigm along a whole lot of different dimensions when it comes to working with children. So in terms of the degree of prescription or flexibility, the behavioral was very prescribed, whereas these social pragmatic approaches could be applied with more flexibility. Even though they were systematic, they would be more flexible in their application. Behavioral approaches, very adult-centered, social pragmatic, very child-centered, because we really want to understand, why do children want to communicate and build on what is natural to children and help be as natural as possible. The behavioral focus more on responses, whereas here we want to really focus on, why do we initiate communication at all in the first place, and provide opportunities for children to do this. We want to do this, you know, instead of a highly unnatural learning context and reinforcers, move towards natural learning contexts that are you know, the most appropriate for young children, and of course natural reinforcers. It was a far more of an understanding and a reference to typical development, So if you remember those goals that I shared of the Levas program, that one of the first goals was just to reduce challenging behavior. And that's not, that's not really a developmental goal. The idea there is to make children indistinguishable from their peers, which is another criticism of many self-advocates. But rather, to focus on typical development and developing typical skills across the board, including language, which was only focused on in the second year, in this approach. And again, just focusing on the social context of intervention, using natural context when children are typically motivated to communicate, so that carryover and generalization can occur to as many contexts as possible. And the treatment of challenging behaviors was also very different in a sense, because of the idea that all behavior communicates, right? So what is the function of these challenging behaviors? And that is also part of ABA. We also do talk a lot about the functional analysis of behavior there. But instead of just eliminating problem behaviors, really trying to understand them and build capacity so that children can use other skills. So with this theoretical change, there was really a proliferation and development of a lot of named or branded comprehensive interventions for children with autism in the 90s and beyond. So the last few decades, there's really been a huge amount of research. And you will have heard of some of them, like the Early Start Denver model, or the Joint Attention, Symbolic Play, Engagement and Regulation, or JASPA. There's alphabet soup there. Any acronym you can basically think of is represented there. And it was kind of becoming quite confusing, which is better, there's financial implications, which one do we get trained in, which has got more evidence of efficacy. And let me tell you, there's a lot of competition between these developers of these programs, and they'll tell you, oh, one doesn't work, But something quite profound happened in 2015, and that was the publication of a consensus statement, where a lot of the developers of these programs got together and actually acknowledged there are a lot of commonalities in these packaged programs. And they actually coined the term in that paper, Naturalistic Developmental Behavioural Interventions, or NDBIs. So it's a really important paper that I think has helped to shape the state of the evidence going forward. Though I think it probably makes out that they're a little bit more united than they are. They're still not united, but I think it's really helped move the field forward. And so what are some of the common elements? Well, they all, to some extent, blend strategies from the behavioral and developmental learning theories to target developmental milestones. And they all share some strategies such as incidental or loose teaching. So that's kind of taking advantage of teachable moments throughout the day, rather than these highly unusual or artificial learning times across a variety of contexts and in a variety of the child's daily routines. And so I'll talk a little bit more about that later. And really that focus on following the child's lead and engaging with the object or activity that draws the child's focus of attention. So this is all about becoming much more child-led and kind of coming alongside a child and inserting yourself into the things that they are interested in and in their play, rather than redirecting them to something you want them to do, which is really hard for a child with autism. We call it sticky attention. When a child is looking at an interesting object, to have to disengage from the object to look towards a person who's often intrinsically a little bit less motivating to look at and come back to the toy is really one of the core deficits in autism. So learning how to come alongside and join in their play so that it makes that social connectedness easier, and creating a naturally reinforcing context for learning, where the adult and child share control of the interaction. So in that paper, they really spelled out that these are the things that we actually are all trying to do. But obviously, there are still a lot of differences among these various programs. I mean, first and foremost is that they have different modes of delivery. So some are clinician-mediated or administered, some are parent-mediated. Even the parent-mediated ones can be, parents can learn in a group setting, or they can be coached individually. And even if they're coached individually, this could be like a live coaching, synchronous type of coaching, or an asynchronous where parents submit videos and then they get feedback. So there's so many different, they do really differ along a lot of dimensions. They have, in the studies, they've focused on different ages, different dosages or intensities, and then, you know, somewhat different incorporation of ABA principles. Even the order at which they target different things actually differs, and one wonders how much all of these matter in terms of application, and I'll talk a little bit about that again later. So what's the state of the evidence about these NDBIs? And I want to draw your attention to this group of researchers led by Mikkel Sandbank and Project AIM, which means Autism Intervention Meta-Analysis. And they've actually published a number of studies looking at the state of the literature in terms of autism intervention efficacy. And they have, I think why it's been so useful that we've had this NDBI term is that they've been able to lump these studies together in the meta-analysis, as opposed to more behavioral interventions, developmental interventions that don't include much structured teaching. So that would include something like DIR floor time or the Hannon approach, which are mostly responsive parent strategies and very little directive. NDBIs, which combine the two, sensory-based interventions, TEACH, which is more like an organizational system for kids and families with autism to structure the environment, and technology-based interventions. So this is the kinds of interventions they've been able to look at as a group and across a variety of outcomes, from very proximal or bounded outcomes that they call them, like social communication, to sort of very generalized outcomes like cognitive level. And when they consider all the evidence, without too much concern about the quality of the evidence, okay, then they say that behavioral, developmental, and NDBIs really have a strong evidence base for effectiveness, and we can say that that is the case. But if we consider only RCTs and studies that that include measures that are not parent report, okay, so they're considering parent report as being quite a biased outcome measure, then really only the developmental and the NDBI cat groups of interventions have a promising intervention base. And if we consider studies that are only RCTs and have no risk of bias whatsoever in terms of the outcome measures, well, then basically all the evidence, all the positive significant effects fall away. But we don't want to focus on that slide too much. So this is another study that they published just this year. I can't actually see my videos. Yep, in 2021. And you can see this was just focusing on the NDBIs, and you can see this is a measure of effect size down the bottom here. And you can see the largest effects, quite large positive effects for proximal outcomes. So those are outcomes that are similar to the targets of therapy. So if they were focusing on child initiations, and they measure child initiations, maybe just in a slightly different context, that would be a very proximal outcome. Or it would maybe it would be parent-child interaction. That would also be a proximal outcome, whereas a distal outcome would be intellectual ability, for instance. And we would hope that this increasing here would have an impact on here, but you can see the size of the effect is still positive and significant, but slightly less in size. And the same with boundedness. So if it's in a similar context or a similar partner and similar materials, then it's very context bound, your outcome measure. But if it's so say you were your target was increasing initiations during play, and then in your outcome measure you got an unfamiliar adult to use similar toys, and in the same clinic clinic where you've been doing your intervention, that would be a context bound because it's very similar in context to the materials and the setting. But if you were to go and measure their initiations in the playground at school with a peer, now your context is different, your interaction, the people the child is interacting with are different, and the materials are different. That would be a generalized outcome. So that's kind of a summary of the status of the research. We can say there are significant positive benefits to natural developmental behavioral interventions as a group, but there are some limitations in terms of the outcomes, depending on the outcome that you use. And I will also want to point out that not every RCT that has been done on NDBIs is included in this meta-analysis. So we can't consider this meta-analysis, even though I think it's a very significant contribution, as the be-all and end-all, because, for instance, the intervention that I've been most trained in, the ESI model, that RCT is not included for various reasons that I can talk about later. Right, so that's the kind of the history, the historical context. I actually need to get my time on. And the state of the evidence. All right, so I've got just under half an hour left. And so I'm going to dive into talk about a few of the strategies that are used in these NDBI approaches, and to try and stay intervention or package independent of any particular package. I've used these two measures that have been developed. So once this term NDBI was coined, researchers started to think about, well, how can we find a measure that we can actually use to measure outcomes across these different programs? Because then we're really comparing apples with apples, right? It might be a different intervention approach, but essentially they're teaching the same strategies. So could we develop measures? And two were actually published, one in 2020, the NDBI FI and the measure of NDBI strategy implementation, caregiver change, which I think is really important because we were thinking about these things a few years ago when these weren't even in existence. So I've used these to kind of talk about the different strategies that are used in NDBIs in three different categories: promoting engagement, encouraging communication, and direct teaching. And I've included some illustrations which are adapted from the World Health Organization's Caregiver Skills Training Program, which I have permission to use from Liesel, who's the lead on investigating that NDBI here in South Africa. And so, what can I say? Right, well, so in terms of promoting engagement, here are some of the strategies that you might teach a family or a caregiver might use, or a clinician even might use. Obviously, to promote engagement, you want to be face-to-face on your child's level and arrange the environment. So what does this mean? Well, you want to orient your body towards the child, be facing them, him or her, seems very obvious. Be at a similar level and within your child's line of sight. So you can see in this picture, this dad's lying down because it gives him a nice line of sight to the child's face. If you're playing with toys, have them between you if possible. Try to keep the environment clear of too many distractions. So it's kind of not rocket science. If you want your child to communicate with you, be physically very close and available so that you can promote that engagement. The second thing for promoting engagement, following your child's lead. So this is what I was talking about a little bit earlier. Join in their play, for instance, by helping them. If they are building some blocks, just hand them the next block. Just help them in some way. Just come alongside and be helpful. If they are doing an insect puzzle, for instance, just start handing them the next piece. You might even say, oh, cow, but don't, take over or tell them what to do, or say, which one is this, or show me the cow. Just do something helpful to insert yourself in their play. Or play some other kind of role, which is non-directive. Maybe if the child is zooming their car, you could get the car and hand it back and say, go again, or something like that. So that's the whole idea of joining in and following the child's lead. Another strategy is copying your child's actions or sounds. And there's actually quite a lot of research on the impact that contingent imitation has on promoting engagement in children. So if a child makes a sound or does an action and the parent copies them, it can have a very quickly put them on the same sort of socially engaged plane. I saw a video, I think it was an ESDM video very early on, of a child playing on a drum. and I can't remember if she was using her hands or her sticks, and she was very, very unengaged. And then the clinician had got a drum herself, the same kind of drum, and everything the child did, that the clinician did immediately, right close to her, and just imitated in terms of the sort of number of hits and the intensity of the hits. And it was incredible how it just changed the nature of this unengaged play to this very engaged, in tune, back and forth between her and the clinician. While this is happening, you also want to be talking about what the child is doing or looking at or experiencing, rather than giving directions or instructions. And so again, just this picture of the book, if the dad can notice where the child is looking, what is interesting the child, and then he labels and points to that thing and gives the word, that is the moment where language can take off. Because we know that actually from decades of language learning research, that whatever you're experiencing in the moment or looking at, and if you hear that language mapped on in the moment, that's when language really takes off. And another way that you can follow the child's lead is actually to give them a choice. You know, this mom is offering a choice, this shirt or that shirt, and then go with what they say. That gives you the opportunity. It's kind of contriving a situation where you can follow their lead and show them that their choices matter and make a difference. Sorry, I didn't explain this picture. So the child threw the stone into the box and mom imitated. She picked it up, threw it in the box, and added the label stone. Yeah. All right. A third sort of strategy that they talk about is using positive affect and animation. That's using rich positive affect in your emotional tone, being enthusiastic. Yeah, it includes your voice, your tone, your gestures, and your facial expressions. But be careful to match your level of animation to the child's sensory needs. You don't want to be so over the top that you kind of overwhelm your child from a sensory perspective. And then lastly, under this promoting engagement category is modeling appropriate language and play. So this first strategy here, match your language to your child's level or slightly above, sometimes called the 1-up rule, where you use phrases of 1 or 2 words longer than what your child uses. So there's a couple of examples there. The child says broken, and the adult says the doll is broken. Or she says the, something that sounds like ball, and mom says it's a ball. That is the 1-up rule, okay? And it sounds very simplistic, but it's really important to start helping parents learn to keep their language simple. Making routines predictable can help children learn language and play. Doing it in a similar way each time, having a clear beginning, middle, and end. Then again, using comments about what your child is focusing on. I've already covered that. And using specific vocabulary. So instead of saying put there, put there, you could say book on table. I was working with a family just the other day, and they were doing laundry, and they were saying put in. They were getting the child to put the clothing into the washing machine. And I said, well, let's use, put is such a generic word, but in is an important word, but let's use the name of the item, sock in, shirt in, pants in, okay? Because that's what is going to increase the variety of the child's vocabulary. And then again, the imitation part. And then once you establish that social connectedness through imitating the child, you can then model new sounds or actions and see if the child will imitate you, or learn that, or use that action or sound the next time you're playing with those toys. So those are the strategies involved in promoting engagement. And again, these are from these 2 measures, and you know, each program, even though they all use these kinds of strategies, will do them in slightly different ways. So what are some strategies that NDBIs endorse for encouraging communication? Well, the first one is to respond to the child's attempts to communicate. And that's, you know, that's very consistent with behavioral theory, because it's the response to a behavior that determines whether that behavior is going to happen again or not. And so part of this is really training parents to learn to recognize their child's communication signals, because they can be very ambivalent or ambiguous, I should say, and they can be unclear. So these might be any kind of sounds or eye gaze, obviously words or gestures, to try and notice these and respond appropriately before they become a moan or a cry, because these are the behaviors we want to shape into better communication. If a child communicates something, you might want to repeat, clarify, and or expand. So that's the picture here. The child says spoon, and then dad says spoon while holding up the spoon. He's repeated and clarified a little bit. Helping parents learn to respond as if the child's communication is meaningful, because it could just be a fluke the first few times. But if the parent responds appropriately, the child will learn that that behavior or that response is powerful and meaningful. And again, related to that principle of using natural reinforcers, respond naturally by commenting on the topic or responding to the request. So if the child says spoon, give them the spoon. Don't say good talking. Kind of sounds like it goes without saying, but it doesn't really. And then how do we get children to, another way we can get children to communicate more and to initiate communication especially, is to use communication temptations, okay? So this is things that we kind of do engineer in the environment to try and give the child reasons to communicate more frequently. So one of those things might be toys in sight but out of reach, like these books on the shelf, or a container that they can't open, because just that arrangement gives the child the opportunity to communicate with the parent. And here you can see that there's treats in a jar, and the child is doing something very sort of prototypical to autism, using mom's hand as a tool. And it's in this moment now that the mom can come and shape a better behavior. Maybe she can say, oh, you want a sweet? Tell mommy, open. And she can take his hands and go, open, and then immediately open the jar. Many of the programs do use signs as a bridge to words. Most of the research suggests that signs act to actually propel the words to come. And not as a sort of a barrier to words or as a replacement to words. So yeah, that's not maybe very overt in every program. It's just something I'm sharing with you. Another way you can get children to initiate communication is to do something silly or unexpected in a predictable routine. And sometimes that could just be waiting. So not doing the next thing that they're expecting, and you kind of just wait and look, and then they might look at you or verbalize to kind of get you going again. Providing choices is, we've mentioned this one before, but again, it's really important for getting the child to initiate and indicate their interest. And this can be within activities, like you want your red shirt or a green shirt, or between activities. Here's a picture of you want your toy or your ball. And you want to really follow each temptation with this pausing. Pausing is very, very powerful. Pregnant pause, I call it, to give your child an opportunity to communicate in some way before you jump in there with a sign or a model or whatever it is. And if you've got something going, you want to try and also start taking your turn in activities, so that the child learns to wait briefly and get the sense that it's my turn, your turn, my turn, your turn, which is how the back and forth in conversation goes. So those are some strategies that are used to encourage communication. And then lastly, there's this deliberate teaching, okay, which some people say is still too much a bit like ABA, but in many ways can be made very natural within a child's context and used to really maximize learning opportunities in a variety of contexts at home. So this is where we might want to teach new language, and I'm going to put all skills, because I will say that in the approach that I'm most familiar with, it's used to teach language. They do learn skills, but it's about the language and the social connectedness. By giving an instruction or cue and waiting for a response, and then providing help. We use the least to most prompting, so the least amount of prompting that a child needs to be successful, and fade those prompts very quickly. And these opportunities are embedded in their daily routines. So here's a couple of pictures, like learning to dry your hands or taking off your shoes. And they really need to be meaningful and productive roles. not things for the sake of just doing it, like labeling many pictures. And I'm going to show you a couple of videos of this. And another deliberate teaching strategy that is included in most of these programs is how to support transitions. In other words, move from one activity to another. And some of those strategies include warnings, like 1 more swing, then it's snack time, or 2 more minutes to play, and then we go. So very overt and explicit preparation for a change in an activity. You might even show an item. So come into the room if the child's watching TV, hold up the bath towel and say bath time, as a way to help the child transition away from the TV, because those transitions can be very tricky. And another strategy is the first this, then that strategy. So I know you want to read your book, but we're going to first do washing and then story time. And here you can see the mom is using that with a picture cue as well. All right, I've got 3 very short videos to show you. This one improved just in such leaps and bounds. All right, so just some closing thoughts. NDBIs as a group are effective in improving social communication skills. And I don't know if you've been thinking about this as I've been talking about them, but the strategies are pretty simple. They're not kind of rocket science, but there is, I really do believe there is an art stroke skill to implementing these strategies that leads to success or not. And kind of, I think when we kind of go through them like this one by one in a discrete way, they kind of think, they don't seem that amazing. And I think that we've got to help parents to implement them in a certain way. And I'm not even sure what the secret to successful implementation is. The developers have gone to extensive lengths in working on fidelity for providers, for caregivers, for coaching the caregiver, the provider coaching the caregivers. I don't think I'm even entirely sure what is the secret to success of these strategies. Is it the intensity, the number of hours per day that they're applied, or is it more the consistency that they're always applied in a certain activity, or is it the order in which we do them? Because the ESI model do those roles very early on, whereas other people will do them more following the lead early on. I don't know, and there's other obviously child and adult moderators that could impact success. But that's all I really want to say, and there are the references that I referred to in the talk that you can refer to. So thank you very much. I don't know if you want to moderate.